We're going to continue with this subject because President Obama, as everyone knows by now, says his goal is to get health care reform enacted this year, despite all the questions about the price tag and the government's role. Big question, though, will it get done? Bloomberg's Peter Cook is in Washington with the very man the president had hoped would be leading his health care push. Peter?
Eric, thanks very much. As we all know, former Senate Majority Leader Tom Daschle was the president's first pick to serve as Health and Human Services Secretary. It didn't happen, but that's not stopping Senator Daschle from being a major player in the health care debate, even in private life here in Washington. He's with me in the studio. Senator Daschle, thanks for joining us. Appreciate it. Going to run up against a break in just a moment, but want to start our conversation with this question to you. What are the chances right now that this actually gets done? Do you see those chances dimming in any way, given what's played out?
Well, I've said now for months, Peter, that I think it's about a 50-50 prospect of getting this done successfully this year. I'd say it's slightly better than that right now. I think it's moving in the right direction. We have a lot of work to do. There are a lot of things that could go wrong. But by and large, I'd say it's slightly better than 50-50. The
president's making his pitch last night. He's doing all the right things at this point?
He really is. You know, he's making the case to the American people. He's engaging them in a good dialogue. He's also working with members of Congress. His chief of staff was on the Hill the other day talking to all the leadership, talking about ways with which to resolve the big differences that still exist. I think they're on the right track.
All right, we're going to get into some specifics with Senator Daschle in just a moment from here in Washington. Eric, send it back to you for the moment.
Peter, we have so much more obviously coming from Washington, don't we, dear? Full coverage of today's Ben Bernanke testimony on the Hill. He's under fire, as you know. Go back to Washington right now, where Bloomberg's Peter Cook is standing by with former Senate Majority Leader and health care reformer Tom Daschle. Peter?
Eric, thanks very much. Continuing our discussion of health care and some of the ideas on the table right now here in Washington, some of the flashpoints. Senator Daschle, thanks for staying with us. The government option, so much debate, so much focus, so much political opposition from Republicans. Is the idea basically dead? If this is going to happen, is a government option not going to be included?
No, I think it's very, very much alive, Peter. I think it really depends on how much the Republicans do choose to cooperate. The more they cooperate, the more likely it is some compromise is going to be found. The less they cooperate, the more you're going to get a pure Democratic bill. If it's a pure Democratic bill, there's no question that a strong public option will be part of the final solution.
You have crafted your own compromise plan, working with other former Senate Majority Leaders, Republicans, Bob Dole and Howard Baker. In your own plan, how do you approach the public option issue? Because you don't have a full government option, do you?
We have what we call a state option. Every state would have the opportunity to create the public plan of their choice. It could be fully government run, it could be a co-op, it could be a quasi-public-private plan. Whatever it is the states choose, there would be a 5-year window within which we would examine just how well they do it. If it fails, if they aren't able to find a solution to that, we would have a federal fallback. We would step in 5 years at the federal level, but by and large it would be a state-by-state requirement and a state-by-state plan.
How do you push back against the industry argument, and we hear it again from Republicans, you create a government role here, you're going to kill the private insurance market. There's no way the government can step in as both regulator and player and not change the playing field?
Well, you know, experience just doesn't lend itself to that argument. First of all, we've got many public plans today. We've got Medicare and Medicaid. At the state level, we have more than 30 states that have public plans today. But I think the bottom line is, Peter, that if we're designing this to make sure that the insurance companies stay exactly as they are, we shouldn't have one. If we're designing this to lower the cost and improve the choice for the American people, we should have one. It's really that simple. Are we designing it for the people or the insurance companies? I would say the people, and if that's the case, we ought to have a plan.
All right, in addition to the government role, the other big, tough, difficult question, how do you pay for this? The president, we heard last night, again making the case that one way he wants to pay for it is to limit the deductions people can claim right now. Other people say, no, you got to tax the benefits, employer-provided benefits for the first time in this country. Your own plan, again, this compromise idea you put forward, Senator Baker, Senator Dole, you'd go after benefits to some extent.
Well, there are only 3 sources. You can look for new revenue, you can look for more cuts, or you can find some savings and modernization. We're going to use all 3, and I think that's ultimately what the Congress is going to do as well. What we say is that if you have a gold-plated plan, the federal government, the American taxpayer, shouldn't subsidize it. We say that we'll take the value of the plan that members of Congress get. If your plan is better than that, you would pay a tax on the difference between your plan and 100% of the value of what members of Congress get today. That's one way to do it. There are a lot of other ways to do it. But yes, we began that effort recognizing that we have to come up with about $1 trillion, and there's no painless way to do it.
No painless way, but that's going to be an incredibly tough sell. There are a lot of Democrats who oppose that. There are also some saying you've got to carve out unions. That's going to be controversial as well.
Well, it is. There's no question it's controversial, but all of this is controversial. It's why we haven't done it in 100 years. We really have to find ways with which to spread the pain, but also spread the benefit. If we get universal coverage, real cost containment, improvement in quality, and changing the paradigm from illness to wellness, it may be worth taking that pain pill to accommodate what we have to do in the early years to put that new infrastructure in place.
Let me just ask you finally about the process. Your role as a Senate Majority Leader, you know this process. There is this potential for the Democrats to get this through on a fast track using only 51 votes, this reconciliation process in the Senate. President Obama, others have said, listen, we'd rather have a bipartisan bill. Do Democrats actually have the legal capability to do this? Do you think we're headed that direction?
They do have the legal capability to do it. It's sort of the emergency process. If all else fails, you have that as the backstop. I hope we don't go there. I don't think we'll have to go there. But if nothing else is available to us to get this job done, I'm prepared to do that. It is legal, and it's been done on many occasions for other things.
All right. Senate Majority Leader, former Senate Majority Leader Tom Daschle, still very involved in the health care debate. We appreciate you joining us and sharing some of your insights with us here on Bloomberg.